Thank you, Mr. Speaker.
The gentleman is recognized for 5 minutes.
Mr. Speaker, our government has been mismanaging medical care for more than 45 years. For every problem it has created, it has responded by exponentially expanding the role of government. Here are some points I'd like to have my colleagues consider. Number one, no one has a right to medical care. If one assumes such a right, it endorses the notion that some individuals have a right to someone else's life and property. This totally contradicts the principles of liberty.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it. Now, the American people, if you put it to them about socialized medicine and gave them a chance to choose, would unhesitatingly vote against it.
This is a big day, the unveiling of our Affordable Clean Energy Rule. What this rule will do will set guidelines for the states to then work with utilities around the country to make sure that every utility makes reductions on their CO2 emissions going forward. It's very different from the Obama approach, which was very much a command and control approach where they dictated to all the states what they had to do. We'll actually be working cooperatively with the states in this.
So the clean air rules over time have been, the states work together and it's all integrated, but for people who say, but air pollution knows no state boundary, so doesn't the EPA need to oversee what the states are doing in order to protect people?
Yes, and we will be. What we're doing is setting the guidelines, and then the states will then report back to the agency as to how they're going to implement this, and we will then be able to approve their plan, and if we don't believe that they've gone far enough, we can always step in as a backstop to make sure that they are making the reductions that are necessary going forward.
Real change begins with immediately repealing and replacing Obamacare.